Hello and welcome. So this is our session for leadership, well-being, self-care for managers. And I am your host, Anouk Partner. And I'll just share a little bit of an introduction here before I get to the panel. So welcome to everybody who is watching. My name is Anouk Partner. I'm the executive director at Future of Good. My pronouns are she, her. For my blind and low vision colleagues, I look like a nice white lady with hipster glasses. A few thank you. I would like to thank the Anishinaabe Algonquin people for the land that I currently reside on. I want to thank my ancestors and all ancestors who have toiled in ways that were unrecognized and exploitative. I want to thank my phenomenal colleagues. And finally, I want to thank my family whose love allows me to sit here today. So our topic today is self-care for managers, and I think this topic is incredibly vital. It's part of the ecosystem of care. Can everybody hear me okay? Yeah? Okay. I'm getting some noise. Okay. Yeah, sorry, I'm just hearing a lot of background. I'm not sure where that's coming from. Sorry about that. I'll just continue. Okay. So our topic today is self-care for managers. And I think this topic is just incredibly vital. It's part of the ecosystem of care. We all know that we can't pour from an empty cup. And I know for myself, when I'm depleted, I lose my empathy for others, become more judgmental, and I'm just generally less human. So I'm thrilled to talk about how managers can care for themselves, build the necessary structures, which lead to more wholesome and caring organizations overall. So what I'd like to do is turn it over to the panelists, and I'll call on each one of you. So please introduce yourself and then share whose love allows you to be here today. So I'll pass it over to Renee first. Oh, you're on mute, Renee.
Can you hear me now? Yes? Yeah, okay, sorry, good to go. Hi, everyone, I'm Renee Raymond. I'm a registered psychotherapist. I'm also a provisional psychologist and registered kinesiologist. I'm the clinical director at Renew Counseling and Psychotherapy in Toronto, and I work with many different folks in terms of, especially based on this topic, workplace wellness, stress management, amongst other things. So I think you said, whose love allowed me to be here today? I would say my little one. He is 10 months old, and I feel like he gave me some permission to be here today. So lovely to join everyone.
Amazing. Iordanka.
Hello, everyone. Very wonderful to be here. My name is Yordanka Patsanova. I am a registered psychologist and an occupational mental health specialist. I work with companies on strategies to align with the CSA psychological safety standards and also just wellness strategies in general for leaders and for employees as well. And I'm a professor of psychology as well at Mount Royal University. In terms of whose love allows me to be here, for anyone that's in Calgary, where I am right now, it's been snowing like crazy. So there was so much snow this morning, and my dad showed up and helped me shovel. So that was amazing, those acts of service. So definitely, I would say my family.
Great. Paul?
Sure. My name is Paul Taylor. I'm the son of Bernadine Taylor and the grandson of Maisie Olivia Baker-Burt and the great-grandson of Rebecca Thompson. And they have informed so much of how I think about the world. So they're also the folks who unequivocally are the reason that I'm here. Really important to me to center the kind of leadership that I think Black women in particular have displayed. So yeah, those are the folks who have allowed me to do some of the work things that I've done over the years, whether it's working in the nonprofit sector, working in consulting, serving on boards, and doing a bit of teaching. So.
That's great. Fiorella?
Hi, my name is Fiorella. My pronouns are she, her. I am joining from Toronto. This is where our national YWCA Canada office is. This is a traditional territory of the Wendat Anishinaabe, how Nosoni, and the Métis. I'm the director of HR at YWCA Canada. I have always been extremely passionate ever since I started working in HR about well-being of culture. Culture of well-being. I'm always training managers to make sure that they are taking care of their teams as well as themselves. So very excited to be here.
That's great. Thank you so much. So I have a series of questions that we'll start with, and we've already talked about who would take a lead on these questions. And then after that, we have some time for some open conversation and for questions from the audience. So just to let everybody know sort of how we'll spend this hour together. So the first question is, why is self-care different for managers or leaders? And I love this question because we think of self-care as being, or I think of it as being fairly homogenous, but I think we do need different strategies based on different roles and different needs. Jordanka, can you take the lead on answering that?
Absolutely. When I think about that question, the unique roles of leaders stands out in my mind, because leaders are, I think, in a position where they're also taking care of their teams as well. So they're often placed in situations where maybe somebody on your team is in front of you and they're really struggling. They may be sharing some personal information, some of their own things that they're dealing with. So, we all have our own self-care routines, our personal lives, but then leaders also, they're sort of the caretaker of their team. And I think that can be so challenging to know how to navigate that. And when I think about training that I've done in the space of mental health and workplace wellness, a lot of the time I tell leaders, it's not that we're giving you the tools to be counselors or psychologists to your team, but to have those, skills to be able to handle the difficult conversations, to know the direction to point your team in. But I think that could be also really challenging. There's a lot of pressure for leaders to feel that they need to solve the problems of their team members sometimes, and that could be self-imposed pressure. But I think that's why it's so important and also unique when we talk about self-care for leaders. One analogy that I use is race cars. So if you know anything about whether it's Formula One, any of the racing, you have these race machines. They're amazing cars, and they perform so well. But they have to go into the pit stop after every number set of rounds that they do. So even though we have these perfectly oiled and designed machines, they need care, because if they don't go into the pit stop and get their brakes checked, if they don't get all the fluids replaced, then they can't finish the race. And it's the same with leaders as well. We could be such high performers, but unless we go into that pit stop and take care of ourselves, we can't really take care of our teams and those of us around us.
Thank you. Yeah, I think it's so interesting, that comment about, leaders are there to take care of their teammates and their colleagues, but they're not therapists. Because I think sometimes it's dangerous when we want to jump in and help someone with a problem, but we have to know the boundaries of our own capacity, because it's very easy to say or do something that is an overreach, or could even be dangerous to someone. Paul, I think you wanted to say something here.
Sure. Yeah, so I think about this question, why is self-care different for managers and leaders? And I guess the first thing that comes up for me is that, of course, managers and leaders are not a monolith. So I think it's really important to recognize that self-care, of course, is affected as a result of that managers are coming from a diversity of places, including those of us that lead and manage, that interact with microaggressions daily, the impacts of white supremacy daily, the impacts of patriarchy, heteronormativity, all of those sorts of things, ableism. So when we have folks in positions of leadership, I think it's important to recognize that there's unique experiences that impose other potential barriers. I also think it's really one of the challenges for managers is they're often sandwiched in between, the folks who are coming up with the beautiful statements, the wonderful commitments and values and all of the nice words, and then the people who are on the front lines who are often disconnected and maybe not living those nice words or those beautiful statements every day. So I think that's a really challenging place to be, because I think folks on the front lines, looking for support and guidance, particularly when they've bought into those nice words that sometimes our organizations espouse, it's the managers who are often on the front lines of trying to mitigate some of the variance there. The other thing that jumped out at me is that, managers, I also think, are often, outside of HR, are often forced to serve as the vanguards of whatever it is that we consider professionalism to be. So that of course is informed heavily by things like patriarchy and white supremacy. So I think managers are often in a really tricky position because, especially without an analysis of some of the systemic the oppressive organizing principles that inform how we do our work. Things like, this idea that was mentioned earlier, that managers have this sometimes pressure, or this feeling that when our colleagues have an issue, that it's our job to solve that issue. To me, that is directly connected to patriarchy and how men are conditioned to lead and to show up. So I think, one of the most important things in conversations like this that I'm excited to unpack as we continue this is thinking about how those oppressive organizing principles affect our ability to prioritize and access self-care, and affect our ability to engage with our work and lives outside of work, certainly.
Oh my gosh, I feel like we could just unpack that statement for that series of statements for the next hour. I have so many questions, but I know I'm just the moderator, so I will limit myself. Do any of the other panelists want to weigh in on this?
I'd love to jump in and say that I think that one of the things that jumped up to me was that I think that the way that managers a lot of the time model things for employees as well. So, for example, especially when you have more junior employees, it can really impact the way in which these junior employees are going to continue to work throughout their career. So if a manager is not modeling like proper well-being, then the people below them, like who are being supervised, are not going to feel like they're working hard enough if they're not, for example, like working like 70 hours a day, just like their managers are, that they're not going to be perceived as being really committed to their work if they're not replying, let's say during vacation time, or having no boundaries, not having, for example, a lunchtime. And these are things that they're going to keep carrying themselves throughout their careers, impacting, again, leading to burnout really quickly, really early in their careers, and just never being able to set those boundaries because that's something that they created, that habit, like so early in their career as well. I mean, even if somebody is a little bit, has been in their career for a while, sometimes in the climate of layoffs that we've seen in the past few years, it might feel like you need to show more. And whenever you have that manager that doesn't practice well-being for themselves, you believe that, again, they're not going to see you working hard enough, and that you're going to be on that layoff list. That's as soon as there's layoffs. So it's going to impact the team because they're themselves not going to be able to take care of themselves.
That's such an interesting, the fact that you bring up layoffs. I feel like layoffs is this topic that brings so much anxiety across the organization, no matter what your role is. So we should definitely dive further into that. Did you want to add anything to this topic, Renee, or should we jump into the next question?
Yeah, just briefly. I think it looks different, self-care for managers, simply because their job requirements are different than others in the organization. A lot of times when I work with people who are in management, senior management at the S-suite level or C-suite level, they make a lot of comparisons to people at different levels and different levels of responsibility within an organization. So commonly, I can't take lunch because this other group isn't taking lunch, or I can only take this type of vacation time because these other individuals are taking that amount. So I think what's really important is allowing ourselves to evaluate what our needs are based on not only our roles, but our own individual differences. Like the amount of sleep I might require might be different than someone else's. And so I really think that's very important in this discussion to also take a personalized approach, as well as a larger systemic approach when we're approaching self-care and well-being, because it's not a one-size-fits-all situation.
Thank you. That's so helpful. And I can tell you're a psychotherapist, because that is such a practical perspective, and just it really reflects what I've lived. So our next question is, how does an organization's culture support or hinder well-being? And I think we've started to touch a little bit about this, but Fiorella, can you lead us in this one?
Yes, of course. So, some thoughts that I have around these question are sometimes establishing sort of like a culture of well-being, also establishing like different ways of working for the organization, and just what kind of policies the organization establishes. So, for example, I always think about what kind of policies we have for paid time off and for time off in general. So are we, for example, allowing people to take days off when they need them? So for example, are we allowing them to take like sick days, what are generally known as sick days, as more like as wellness days? Are we allowing them to take them for emergencies or for just mental health days? Are we including, for example, menopause and period symptoms as part of that? So I think that it's around a lot of like how we establish these policies and how we also put them into practice, to let people know that we really care about their well-being as a whole, and well-being looks in a lot of different ways, including again, like being a caregiver. Some people have, again, children, and if the child is sick, they don't want to have to be negotiating taking like an hour off to take care of the child, but being able to take the entire day. And I think that also being able to tell your supervisor, my child is sick, I need to pick them up, I think I need the rest of the day off, and the organization responding with, of course, whatever you need, we're here to support you, as opposed to, that's not your job, or you're ex-parent, you have a partner, leave your child at their grandparents. Or I think that when organizations, I think that I've seen these a lot, organizations hiring people and saying, yes, we have an amazing work-life balance, we have unlimited time off. And then when you start working at that organization, turns out that most of the team is absolutely burnt out. So it's just making sure that you're always not just preaching all these things, but also practicing them, and not just telling people what they want to hear to get them through the door. You're going to lose them very quickly if like work-life balance was one of the things that they were looking for and they all of a sudden not have them. Other things like, for example, like flexibility on the way in which they work, making sure that, again, like as part of the policies and the ways in which people work, like not expecting people to reply right away, or knowing that I can block my calendar in the middle of the day and go for a walk because I'm feeling stressed out, or that is the only time where my dentist can see me in the next month. So knowing that I can just block my calendar and go off, and nothing's going to happen because I know that I can complete my work at any time. Or there's the flexibility too for people who maybe their child's daycare or school starts at 9 a.m. They want to have or maybe 10 a.m. They want to have that time with additional time with their child that contributes to the well-being of the entire family as well. And I think that knowing that you can do those things, having that flexibility, having a team diet or a manager that actually allows you to do that, and you as a manager being allowed to do those things yourself, knowing that you don't have to micromanage people, can really support. And on the other hand, not having a lot of these policies established, or not listening to employees when they're saying, we need this, we would like to see that, really can impact the way in which employees are seeing the organization, employees are seeing the culture of the organization and their own teams.
Thank you so much, Fiorella. That's very comprehensive. Renee, would you like to add something in here?
Yeah, for sure. So one of the things that comes up a lot with a lot of the clients I work with are feeling overwhelmed, especially during transitional moments, big transitional moments within organizations. As was already mentioned, like there are a lot of layoffs right now. There's a lot of downsizing due to the economy and other factors. And so, in having a lot of empathy for organizations, they have to make a lot of big changes, and they're not always easy ones. I think, especially in a lot of those moments of big change, there has to be comprehensive planning and strategy and a way of evaluating as well efforts to maintain and help balance employee pressures during those moments. So a common thing that happens, I hear that there's like a bunch of layoffs, or there's like a trickle of employees leaving an organization, and then work gets redistributed. And then there's an immense amount of pressure on employees to do double the work in less time. And again, we recognize sometimes there's a time to push in organizations and in life, and there's a time to relax. And so if you are going to see that your organization is going through a time of push or a time of busyness, having a strategy, when does that end? What is in the forecast for when this will let up? Giving and delivering that information to employees so that they can also strategize and plan vacation time or plan their affairs accordingly. And then again, when things are they're out of that season, also just like as Fiorella mentioned, allowing and really promoting employees to use the time that's available to them. Saying that, hey, you have this many vacation hours that you have to use by like March, whatever, at the end of that season is not really helpful to someone. So getting used to sharing that dialogue. Hey, are you taking some time off? Sometimes managers are sometimes the first ones to notice when an employee isn't doing so well. And so, it doesn't always have to be in like deep conversation, but that might be a really good time to remind someone or their team as a whole of, hey, are you guys taking your lunch breaks? Are you utilizing your time outside of work to do things that don't consist of work? When we talk about work-life balance as well, if there's a big promotion for work-life balance, what does that actually look like? So, and I'm very much, again, a really big advocate of personalized care. So, if you are going to have these conversations with employees too, giving even some space and time for them to reflect, what does work-life balance mean for you? How can you actually operationalize that? Is that something that, again, where privacy is respected, that employers can check in and managers can check in with their staff to just be like, hey, how are you doing with your work-life balance? Like, based on the goals you set in March, how are you stacking up? And again, that should look different at different times, especially if it is a busier time, making sure that whatever is appropriate for that season, that employees are reminded that they need to make those adjustments, as well as managers. Because the managers, again, it starts at the top, right? If they are burnt out, if they are not maintaining their own balance, and again, they have a lot of pressure from below them, from above them, from outside of the organization, these things don't get translated in the way that they need to.
That is very helpful and incredibly practical. I know at Future of Good, this is our hustle season, just because we have this summit, then we have another one in a few months. So it's incredibly busy. But in the summer, we moved to a 4-day work week. And I wish we could do that all the time, but it's that sort of that seasonality of like, okay, summer is coming. Everyone can sort of slow down a little bit. I absolutely adore that. Paul or Iordanka, did you want to share something here?
I'm happy to offer a couple of thoughts. I love the kind of mention and focus on vacation, particularly as the role of managers and leaders in supporting staff to take vacation, and how that affects culture. I would say I'm probably the first one to book vacation on my team, and I talk about it, and I tell them, I go through the calendar also, and I look for when there's a long weekend, and I take the day after the long weekend, and if I can swing it the day before. Because my calendar before that would get filled, and I wouldn't have a chance to do that. But I think that's how we kind of change the culture. We talk about vacation as if it's something that is just, something that we need to take, and that we are taking, and we're demonstrating that we're prioritizing how that we take it. As I think about org culture, I think it's really tough to completely separate organizational culture from societal culture, because I think organizations it's really interesting to see how people-centered they are. And I think one of the things that impacts how people-centered an organization might be is how much they've embraced capitalism. So I think about things like, going back to this idea of the 4-day work week. I'm very fortunate to work a 4-day work week throughout the year, and my colleagues do as well. And I think, there once was a time where when we wanted to contact someone, we had to write a letter to them, go to a post office or go to a post box, send them the letter, wait for them to get it. Then they would get it. They'd open up the letter and they'd write something back. Like, that's how people did business. And then faxes and emails and all of these things, all under the guise of this promise that workers wouldn't have to be working the way that we currently do. And now we are working more than we ever have. We're tethered to these devices. So I think, again, it's tied to this, I think, larger issue of how an organization either embraces or rejects capitalism, especially when it comes to organizational growth. I think one of the ways that this can also affect cultures of an organization is if, many organizations define success as their budget size. You'll hear organizations say, and our budget is this much and our staffing is this much. Well, what ends up happening often in those cases that I've seen is organizations are taking on too much. And the folks that are, leaders might be building reputations, based on all the work that's being taken up. But that impact and that work is often being, it's on the backs of frontline workers, low-wage workers, often racialized women, who simply have too much. And of course, this is going to lead to burnout. So I think it's important for organizations to wrestle with and I would just say identify the opportunities to push back on capitalism and its harmful effects.
Do you have an example of that, Paul? I find that a really fascinating idea, but I wonder, I always think in very concrete terms, so I sort of need to wrap my brain around it.
Sure, certainly. So at Evenings and Weekends Consulting, we have a pretty strict 9-to-5 policy. So that means that no emails or meetings are scheduled before 9 or after 5. And it's not just a self-care piece. This is a gender justice piece because, of course, folks who are not the primary caregivers of children have the opportunity to respond to employers who send emails in the evening, more often men whose work then gets seen. So I think things like that, I think, benefits, for example, why we live in a world where we allow people to have to wait for 3 months before they can access medication that might be life-saving, because it saves us a couple of bucks. Like this, we're telling people something when they join our organizations, how we care about them. We're informing them of the culture. We're informing them of where they fit in our hierarchy of priorities. And it's certainly not at the top when that's the case. I don't know why we don't all provide benefits and all provide benefits starting at day one. So those are the sorts of things that I think have us pushing back on capitalism, including practices like a 4-day work week. It means for business, certainly, that we're going to have less work time, but again, it's pushing back on these ideas of what success looks like based on who's defined them.
That's great. Yardanka, did you want to jump in there?
My thoughts around that is it's interesting because I think we have to acknowledge our own privilege on this panel here that we're quite, it's these white collar professions that we have, and we're not frontline workers that don't have the option of doing a 4-day work week, right? So I think options like that, for example, my experience has been in the oil and gas industry for a long time. And when we talk about organizational culture, we also have to realize that that's not a one size fits all. Yes, you may have your corporate values, but your office workers are going to have a lot different culture than, for example, field workers, if you have that in your organization. So when I think about the oil and gas companies that I've worked for, the people that are out in the field, they have to run 24 hours. So there's no option to shut down plants. That's just, you can't run a plant that way. So when you're talking about a 4-hour work week, that's really something that doesn't reflect their reality. I think back to my experience as well. So for example, I'm an immigrant and my parents have often had to take jobs that were, quite low on the labor options. And same thing, even now, they don't have the option to do that. They have to be in the office. They can't work from home. When we're talking about physical labor jobs, we have to take that into consideration as well, that I think some of these wellness practices, we have to think about how can we adapt them to the environment that is not office workers, is not people that can be remote all the time, because those things make a difference as well. Some people don't have the options that we do. So it's figuring out as well, especially for, as I said, tying it back to organizational culture. It's not going to be the same, especially if you have a complex organization with a lot of employees in different roles, in different geographical regions. So there's a lot to think about, right? I remember being even at one conference in the States last year, and they talked about companies that were looking at where do their remote workers live, and they're adjusting their pay based on that. So the discussion was about, okay, you're doing the same work, but then do we pay the employees the same if one of them is living in a place where they need $2,000 a month to live versus somebody is living in a place where they need $10,000 a month to live? So it was really such an interesting discussion. I don't think there's a right or wrong answer to that, but it was interesting how companies are approaching that aspect of it, because it's just opening up so many issues.
Paul, you wanted to respond?
Yeah, I'm going to push back a little bit. On a couple of things. I think I'm really committed to equal pay for equal work. So, I think it's important that people get paid a livable wage, but I struggle with these kinds of notions of people getting paid differently based on where they live. I think that can be problematic. And I also think, when it comes to the 4-day work week, I think this is a prime example of how insidious capitalism has been. Sure, it's absolutely possible for folks working on the front lines to work a 4-day work week. It just means hiring more people, and it means deprioritizing or making a little bit less profit. I think these are the kinds of questions. If we want to truly hold up self-care as something that's important, it's, to me, it's not a program. It's not a nice statement. It's not a nice to have. You actually have to look at how you move resources and how you move power to be able to prioritize something like the wellness of our colleagues. So I think a 4-day work week absolutely is possible for all of us.
Just to add something to that, I was reading about nursing, because that obviously is a profession where it's based on shift work. And they were saying one of the big issues with burnout around nurses is because there's so few nurses are being asked to work multiple shifts and then can't take their vacation time. So even if there is this sort of top-down wellness programming, the systems in place have not actually allowed that staff to take advantage of the basic programming, let alone, other things. So anyways, yeah, I know it's fascinating. Okay, so I'm going to hop into our next question. And I love debate, so feel free to disagree significantly with each other. So for middle managers who may not have the resources, and by this we mean time, money, support from leadership, how can they model well-being? And Paul, I'll come to you first on this.
Okay. Let me see here. I was jotting down some notes. I was thinking about this in advance. Yeah, going back to vacation, I think one of the things we can do is check in on vacation. Like I talked about how I proclaim my vacation. I think in the same way that we're checking in on project deliverables, again, we're telling people what we're valuing by what we communicate. So if we're communicating with folks about their vacation in the same way that we are about project deliverables, we're encouraging people to recognize that we think that's important. So, there's nothing wrong with, for us, one of our dashboard indicators of success is where we're at in terms of how many people have taken their vacation that they've accrued at this point. And if we don't have a certain percentage of folks who have taken vacation at that point, that tells us as an organization, we've got to stop and do some more work to encourage vacation. I think that's one thing. I also think, challenging cultures of blame. Many of us have navigated cultures of blame, and then we're in leadership or management roles, and it becomes really hard for us to distance ourselves from kind of blame mentalities in favor of ones that center accountability. So, that's the kind of, that we will make mistakes together, but we will learn from them together. We'll be accountable together. I think that's a really important piece. the other thing is, I think, encouraging grace, and recognizing that we're all going to make mistakes, and that's okay, and that there are opportunities for us to learn from each other. And I think about sometimes when I go to I think about going to my doctor, and just going back to that piece around feeling like we need to know everything. When I go to my doctor, I'm always, at first, when I first saw my doctor, like pulling up some computer program and punching in some things, I was like, what's going on? Aren't you the doctor? You should know all these things. And then of course, the doctor has to consult resources and shouldn't be expected to know everything connected to what we might show up with. So I think we need to practice a little bit of grace with ourselves, and also, push back on this idea or this expectation that we have the solutions for everything. Yeah. And then maybe the last thing I would say is, again, coming back to these oppressive organizing principles from a racial justice perspective, from an equity perspective, pushing back on these principles in ways that make sense for our organization, that is about self-care, particularly when we recognize we're all interacting with our organizations and our organizational systems differently based on our histories of class, education, race, gender, all of those things.
That's fantastic. Thank you. Iordanka, did you want to add to that?
Yeah, I think about just if you don't have the resources to maybe implement these types of things. But even if leaders are interested, there's a lot of free resources out right now. Paul, you talked about the sort of moving away from blaming culture, the psychological safety, the CSA standards. That's what exactly they're based on, and they have a lot of free resources where people can go. They can download documents about how do you implement them, not just on an organizational level, but even on a day-to-day basis. And I think that's what it goes back to, is if there's no backing in terms of a larger organizational strategy, as a leader, you can still set the example for your employees, just of even how you show up. Because as soon as an employee starts at a company, we are giving them cues all the time about what is the culture. Do people stay late? Do people show up early? Is the expectation, if I see my new boss that they're not taking lunch and they're answering phone calls during their break, I would say to myself, oh, that seems to be the culture, right? And so being aware of those messages that we send. And then also, Renee, I think you talked about the individualized self-care. So what does self-care mean to everybody, and just really being able to tailor that to individuals. And I think that's probably looking at our psychology lenses with this. But sometimes knowing that, if I had a client in my private practice and I knew that maybe they were dealing with something, and the way that they actually needed to do it is they need to be at work a lot so that they're not at home. And maybe that's something that is helping them cope with whatever is going on. So I think sometimes not pushing people to do things, right? Not having blanket policies like you have to take vacation by this date or you have to do this, because sometimes if we're pushing that self-care piece, it may not fit for everybody. So again, I think it's probably taking that individual lens, having the policies where people can be free to do so. We don't want to be in a climate where people are not free to take their vacation. That's definitely not what we want. But sometimes self-care might look very different for a person, and it may include maybe not taking vacation, right? So having the freedom to individualize whatever plan works for us.
That's great. Renee, did you have anything to add into this one?
Yeah, sure. I think managers and middle managers in particular can model self-care and well-being by just really allowing themselves an opportunity to ask themselves, what is the image that my staff is getting from what my practices are. So, if they are, saying one thing and doing another thing, that may kind of be very confusing for individuals. Sometimes people hear, we care about your well-being, and then they see their manager, like jumping through like 60 different meetings, and they're always the ones that are sending emails after hours, even when there is a policy saying, you shouldn't do it, or you don't need to do this after this time. So being, I think, reflective to see if the things that they're doing are consistent with what they're preaching. Also looking at how are they showing up at work. You know, a lot of times we feel as though we are being, showing up in a certain way. So we feel as though, I am approachable, or I am this, I am that. So sometimes this is where I know people love doing is, doing employee feedback moments, and just getting a sense of from their staff of what, how they feel about management. And I know that can be a hard thing because, being perfectly honest, no one really wants to hear anything less than stellar about themselves. But I think that this is really important because it gives managers who are truly looking to make some changes an opportunity to see what is within their ability level to tweak. So if it's something as simple as a manager I remember at one organization I used to work for didn't realize, like, they just kind of came in and started working, and some people were just like, he seemed kind of really unfriendly because he just didn't say good morning, and then there was one employee who was just like, I guess culturally it was always like you always say good morning to everyone past someone in the street, and so that was just a little tweak that really help to improve the workplace culture and dynamic. And, sometimes, again, these changes don't need to be massive. I am quite aware, depending on the organization, depending on the resources of the organization, and their own philosophies, as I do believe in a lot of the things that Paul shared, but I know that a lot of employers don't. If we're going to be perfectly honest, they are profit driven. They are in an international market, or they are competing in a certain way. So, this leads, of course, managers and individuals to make choices about where they are able to, where they work, what roles they take, but where they are, this is where I am, this is where I'm going to be able to look at what is within their control to make adjustments for, maybe sometimes, your workplace can't get the 4-day work week, but you like the people you work with, and it's a positive culture. You can share together, you can laugh together, and that might actually be something that, if I got to work 5 days, at least I can be here and enjoy my time. That is a win in terms of wellness. So, of course, on the other end, there are some changes that, as middle managers, they can give a lot of feedback to upper management and be advocates. And so, sometimes it goes a long way to say, hey, this is what people on the floor and myself are feeling. If employers are really trying to be robust and maintain good qualified staff and not want to deal with like a massive transition of, a whole bunch of people quitting all of a sudden, then I think that they may take that a little bit more seriously. So also not being afraid to stand on the needs that they have to be successful, because again, that can be workplace wellness, and operational goals don't have to be oppositional factors. They can be very much in alignment, different purposes, but sometimes that case that middle managers can make for themselves is a win for the organization and allows everything to move seamlessly.
Renee, if I may just piggyback on that as well, and this may be helpful to any managers that are on the call. I mean, there's so much research out there that actually looks at return on investment when companies employ wellness initiatives for their employees. And that is from shortening disability claims, how much, long-term or short-term disability people take, to profits. So there's a way that I think these goals can actually merge. They're not in contrast with each other. When companies employ wellness strategies, self-care initiatives, when they take care of their employees, productivity goes up. People want to be there. People are being more productive. They're happier at work, and the company thrives. So I think there's ways to actually marry those two things together, because when we see companies invest in wellness, the return on investment, I think it was something, the last research that I have seen, you're looking at, for every dollar you spend in terms of wellness initiatives, you're probably getting about 5 or 6 back on your return on investment. So that is a way to push those initiatives forward, where you're not in conflict with that, profit strategy of senior leadership.
How do you feel about that, Paul, using capitalism against capitalism?
Well, I'm still processing some of that, but one part that did strike me was it dawned on me the importance of like not just introducing a wellness program or strategy. They're not all the same, and often employers are, compelled to do this based on the shifting expectations of employers. So you can't, they're not all the same. So I think one of the things that's really important to do is evaluate the efficacy of your wellness program. And when I say evaluate them, I don't necessarily I mean the folks who are meant to engage with these services should be centered in terms of the evaluation process, because I know employers that introduce what they consider the most beautiful wellness programs, but that nobody engages with. So I think that's really key.
That's great. So we've got one more question, and then I'll go to the audience. So anybody who's watching, please pop your questions into the chat. I'm monitoring that. So this last question from our prep is, what is a practice that you've seen sorry, I'll start over again. What is a practice that you've seen be transformative in supporting well-being? And I'll go to Renee first on this.
Yeah, so I was thinking about this question at the manager level, and it may seem like a small thing, but I think it's really helpful. I think sometimes giving ourselves like cues to be able to transition out of work and into work is really helpful. So of course, not at the big organizational level, but I think it all matters. So, having a bit of a routine to allow yourself, especially people who work at home, that the work day is done helps with maintaining these important boundaries, especially with COVID and a lot of people working from home, like let's say where they would have closed their laptop and got on, the subway or got in their car, and that would signal to them, all right, now it's back to my time. They don't have that as much. So finding some sort of routine to allow yourself to transition to, your lunch, your break, the end of the day. Okay, I'm starting the work day. I think it also helps our system just kind of adjust to, oh, I'm not working. I can actually feel like I'm not working right now. So that's my tidbit.
That's great. Fiorella, do you have anything you'd like to add into this?
Yes, I can start by piggybacking a little bit on that. I think setting boundaries has been, I think, a huge I think a huge change for a lot of people that I've worked with. I think that one of the things could be when I always tell managers or myself, when you start a working relationship with somebody like manager, direct report, it's always good to talk about how they like to be managed, but also how you yourself as a manager like to be. So for example, if you are the kind of manager that disconnects, letting them know, like, I work from, let's say, 8:30 to 4:30. That's when I have to, I don't know, get to yoga, go pick up the kids or anything. And then knowing that that's sort of like your boundary. I know that a lot of managers also give their personal phone numbers to their direct reports, but also if you're going to do that for emergencies, establishing what an emergency is. Mm-hmm. I have seen in the past people like managers who are on leave, like including parental leave, and their direct report will be messaging them for things that were not emergencies or were increasing stress outside of work. It made things very complicated for the manager. So if they're going to do that, they have to establish what an emergency is, and making sure that that there's an understanding. I think that another really important thing that I'm working with my team right now is creating a coverage plan when you as a manager are going to be absent, because I think that a lot of managers, the reason why we're always connected, or even when we're not at a manager level, when we're taking time off, either because of an emergency, because we're sick, or because we're taking vacation, for example, is that you are not sure that things can run smoothly without you, or if people need support. So having a coverage plan established from the beginning is very useful. that's an easier way to go on vacation. There's one less thing to do before you leave. But also, again, if there's an emergency, if there is unfortunately like a death in the family or anything that you have to deal with that you cannot be thinking about work, your direct reports know who to go with, who to go to if there's like any issues, or who they know who's going to support them. And the people, like, let's say other managers or your supervisor too, they know that they're going to be taking over for a few things for you. So that's something that can really be helpful for, again, like people disconnecting when they need to disconnect to take care of things. And I think that I don't know why, I always just talk about like no meeting days. I think that when that's not something that can trickle down on an organization, I think that if a manager is able to do it with their team, it's always been helpful for them to know that they're available for their team, of course, but know that they can push a lot of work forward. A lot of us, when we're managers, like it's sometimes really hard to find time to be individual contributors as well, which is a huge part of our role still. So having those no meeting days are really helpful for us to continue working on either strategy or just moving our work forward, but also for direct reports, knowing that they don't have to be jumping from one meeting to the other. Not every meeting is going to be with you, so that also allows them that time.
That's phenomenal. We do no meeting Wednesdays at Future of Good, and I can't even tell you how much it helps in terms of creativity and focus time and all those types of things. So yeah, plus one. Danka or Paul, would you like to add to this?
I was thinking just along a particular strategy that I implemented, and I think going back to Paul, your comment about really also asking people what they need, and if you're evaluating a wellness strategy, knowing what is it that people in the company want rather than just giving them something. But one of the things that I observed is once we started, just even talking about mental health in one of the companies that I worked with, they were some of these people that were working in Northern Alberta. Well, we know that it's, very male dominated, just these fields of refineries, oil and gas, where mental health, as you can imagine, is really not talked about that much. And so, but once we actually started generating some conversation around it through a lot of different strategies, we actually saw mental health committees pop up, which were just workers that would get together and they would say, hey, this is what we need, whether they were asking for suicide training, whether they were asking what they can do to maybe put a handout together with the counselors in the community that were accepting clients. But they would really have those, feet on the ground and assess the needs of the people that they were working with. And then they would come to the people that were doing wellness in the organization and say, hey, this is what we need. Give us some resources on this. And I found that that was quite helpful because we were actually working with what people needed rather than just giving them things that we thought they needed. And maybe they just did not want those things at all. So again, I think going back to that fit where you're getting feedback and you're also getting information from the people that you're actually trying to reach.
And I would say, I was reflecting on Renee's comment and around the importance of having cues to say that the day's over or lunchtime has started. And I was a little tickled because I was reminded of a practice of mine. Now I work virtually, but before this, I worked in a physical space with all of my colleagues. And much like vacation, being the first one to sign up, when it was 5 o'clock, I was ready and at the door, and I would say to my colleagues, if I were you, I would go home because we might start charging you rent if you stay past the time that you're supposed to stay here, So I think that there's certainly a practice that encouraged people to go home and recognize that I'm going home. I think a couple of practices that jumped out at me, and I think one was mentioned already, but the idea of wellness days, why we wait for people to get sick to be able to prioritize their health behooves me, so having days where people can do what they need to do to prioritize their wellness, whether it's watching Survivor or Love Island, just saying, or whatever it might be, people do whatever they need to do. I've also seen caucusing work really well to prioritize wellness, particularly for communities that navigate microaggressions. So being able to, at Food Share, we had a Black caucus. So being able to connect with people, with colleagues with similar identities, to be able to build community and have a support network as we're navigating things like microaggressions and racism. I think things like emergency loans, recognizing that our colleagues are whole people and need access to sometimes things in an emergency. So things like no interest emergency loan programs. And I think any sorts of commitment to decent work really helps advance wellness. But maybe the last few I'll speak to are, ensuring, when possible, ensuring that people have access to a coach, so someone outside of the organization that can support them on their journey. And that could be a coach, that can be an elder, a community elder, but I've seen that as a really transformative practice for supporting folks in their ability to care for themselves in the workplace. And what else did I write down? And one other silly practice, failure wakes. So acknowledging, challenging a culture of blame by hosting failure wakes. What did we fail on this year? And how can we learn together? Again, challenging this idea that failure is something that one should be blamed for, but it's instead of being, something that an opportunity to learn.
I love that. I love discussing failure and dissecting it. I always say failure has taught me so much more than success.
Me too.
Okay, so we have a question from from one of our guests. It's hard to know what to call people in a virtual setting. So I heard some of the panelists talking about the 4-day work week, and I wanted to see if anybody had any additional recommendations when evaluating or getting buy-in when suggesting a 4-day work week. And the main question here is, what is the first step or main recommendation in advancing this in our workplace?
So I can maybe start that one. I work at a 4-day workweek organization. I think I've been really impressed by the work that Imagine Canada has done, particularly around the 4-day workweek. So they are a 4-day workweek organization. How they started was as a pilot. So they started a 4-day workweek pilot, and they evaluated the efficacy of the pilot, the impacts of that pilot. And what they also did was they shared their learnings. So they've got blog articles and shared their learnings from that experience and the overwhelming benefits of that experience. So I think that's a great place to start. If there are folks within your organization that you need to convince of the benefits, and connecting with other organizations that have prioritized doing something like this, I think is really important.
That's great advice. We're almost at time. Is there anybody else who wants to just very quickly chime in on that? No? Okay, fantastic. So we're going to wrap up now, and I just want to thank all of our panelists. And I want to actually share something that I noticed. I feel that, this is a panel about self-care for managers, and we talk so much about employee and team well-being. And I think this is actually really beautiful. Like, it's I think there's so much care that goes into leading or managing and being responsible for staff, and that is actually a very big responsibility. So I just wanted to highlight that even when we talk about self-care, we are talking about the care for others. So thank you all to our panelists, and we'll meet back in the main plenary. Thank you.